Good afternoon and welcome to our weekly COVID-19 public health update with Montgomery County Executive Mark Elrich. I'm Lorna Virgili, Hispanic Public Information Officer, and joining us today is Dr. James Bridgers, who is an acting health officer for the county, Dr. Earl Stoddard, Assistant Chief Administrative Officer, as well as Sean O'Donnell, who's Program Administrator, Public Health Emergency Preparedness and Response for the Department of Health and Human Services. And also joining us from the Department of Health and Human Services is Dr. Raymond Crowell. And last but not least, Councilmember Craig Rice. Welcome. Thank you for joining us today. Members of the media, we will commence with a presentation from the county executive and also from the council member. Then we'll open it up for Q&A for that particular topic, and then move on with the COVID-19 public health update. And with that, good afternoon to you, Mr. County Executive. The floor is yours.
Thank you. So thank you, everybody, for joining us today. Before we start with our update, I just want to acknowledge the passing of Sidney Kramer. Sidney worked for the residents of Montgomery County as a council member and a state senator before he became Montgomery County's third executive. And he served as executive from 1986 to 1990. His energy, passion, and willingness to speak frankly on important issues like education, business policy, and mental health were a part of his contributions to this community. He'll also be remembered as a strong advocate for seniors. My thoughts are with Sidney's children, Miriam, Rona, and Ben Kramer, who have continued their father's legacy of public service, as well as to his grandchildren. May he rest in peace after serving his community so well for so long. I want to take a moment to comment on the shooting in Buffalo this weekend. It's had a profound effect on many people in America. This, like many of the other mass shootings, the effect goes beyond the immediate victims in the immediate community. 10 people were killed in a grocery store in Buffalo, New York. Countless others have been traumatized by the attack. It not only targeted the innocent, but was also motivated by hate. The police discovered that the man they've arrested for the crime drove hours to get to that supermarket because he wanted to target the Black community. And that was the purpose of his trip, to find the most impact that he could possibly have. It's the kind of detail that prompted President Joe Biden to call the shooting terrorism when he visited Buffalo on Tuesday. And it is terrorism. When you kill people randomly, and you do it out of hate, it leaves everybody very insecure about what world are we living in. People should be able to feel free and safe about moving when they're moving about in their communities. And this is the kind of event that just strikes fear into people. And we can't allow this to be tolerated or become normalized. Replacement theory, which motivated this person, is pure garbage. There's no replacement of anyone planned. And if people are concerned about replacement theory, the last replacement event in North America was when Native people were replaced by Europeans. That's real replacement. Along with the demonization of critical race theory, otherwise known as history to most of us, these attacks are an effort to build on our efforts to build an inclusive and unbiased community where all are valued and all are safe. We agree with the president when he calls on the nation to give hate no safe harbor. Montgomery County will provide no safe haven for hate, and we will aggressively pursue and prosecute perpetrators of hate crimes. During the pandemic and before it, Montgomery County has seen its share of hate crimes. There is never a good excuse to target any group, whether it be Asian Americans, Hispanics, the LGBTQ community, Muslims, African Americans, or anybody else. The Montgomery County State's Attorney's Office has launched an initiative to make it easier for victims of hate crimes to come forward and report these incidents, but sadly we know that many will not. We have links to the county website that can help identify what a hate crime is under state law and what to do if you believe you've witnessed one or experienced one. Let's keep what happened in Buffalo in mind as we move forward and remember that hate has no home in Montgomery County. On a happier note, I'm pleased to be joined today by Councilmember Craig Rice so we can discuss an exciting new opening. Craig and I were proud to be there this past weekend to launch Ignite Hub at Montgomery College in Rockville. As of Monday, reservations are now being taken for kids, teens, and adults to begin using this new facility for information technology, coding, and other lessons that will help us adapt to a changing world and be ready to lead the way forward. This is an amazing opportunity for people to learn about coding, to learn about what you can do with it, and it's going to inspire, more people. When I was there, I saw programs that some of the students had already created that had actual, real value that would help people do things as they maneuver this increasingly electronic world. So it's a very exciting place. Montgomery County has many partners to thank for bringing Ignite online, including Montgomery College, MCPS, and Montgomery County Economic Development Corporation. And we're very, very fortunate to be partnering with Apple on this project. Apple is donating most of the equipment, which makes up the labs and the learning space for the Ignite Hub. Craig was really instrumental in helping bring this all together. And actually to continue working on it through COVID and everything else to make sure that it happened. His work on behalf of Montgomery County on broadband issues paved the way for all of us to benefit. Not only is Craig making a difference here in Montgomery County, but across the nation. During his role on the National Association of Counties, NACO, on the board of directors, Craig chairs the Human Services and Education Policy Steering Committee, and also served as co-chair for NACO's National Broadband Task Force to bridge the digital divide. The work we're doing here and that Craig is sharing with our peer counties, large and small, urban and rural. We're very fortunate to have him working with us on this critical issue, and I'm going to now give him an opportunity to talk a little bit about it because you really played a major role in making this happen. Then we'll come back to the COVID update. So Craig.
Well, thank you very much, Mr. County Executive. And I really want to thank you for your support as well. Obviously, when it comes to projects like this, it's one thing for a lone council member to try and push something forward. It's another thing to have the backing of everyone in the community, including our county executive, who understands just how important this is. This hub was born out of an idea about making sure that some of the opportunities that I had growing up, coming up through the magnet program, the very first math, science, computer science magnet program here in Montgomery County at Tacoma Park, and learning coding on an Apple IIe computer and logo would be something that would not be a unique experience to many who look like me in this community. It certainly is something that wasn't lost on me, being the son of a teacher who had all of the educational opportunities that allowed for me to be able to dream big. And we know what happens when we allow our children to dream big and we give them opportunities. They succeed and they fly high. And so it really was something where that was the impetus for this Ignite Hub, working with Apple, with Montgomery County Public Schools, with Montgomery College, with the Montgomery County Economic Development Corporation to really come together to say, how can we break this cycle of people of color and of lower socioeconomic status, oftentimes not being involved in technological pathways? And the best way for us to do this was to get them immersed into the technology through the Montgomery Can Code program. Through that Montgomery Can Code program that started 3 years ago with just a little over 100 students, it has now grown to over 1,000 students. It's also grown to where we have coding clubs in many of our schools. We also have coding camp. And now we have the Ignite Hub, a place where Montgomery Can Code can call home, but also more importantly, something that represents to the overall community that you are not forgotten when we talk about the technological age and the age of coding. We've also remembered our incarcerated, those that are incarcerated, and created the Coding Our Way Home program. I again want to thank the county executive for his continuous support budgetarily, as well as with his overall just working with our elected leaders throughout the area and also our department heads to ensure that everyone rallied behind this project. This could not have been done alone. This was a team effort, and we should be very proud of the fact that Apple is looking at Montgomery County as a shining example of how to make sure that we're breaking the digital divide. There's more to come on this. This is just the beginning, but it is the very beginning of a great opportunity where I think this Ignite Hub will actually serve as Apple's North Star when it comes to what it is that we do to ensure that we have coding and technological connections for all in our community. Thank you, Mr. President, Mr. County Executive.
Thank you, Council Member. Members of the media, do you have any questions either for the County Executive and or the Council Member regarding this particular topic? Ignite? Just giving you a minute. No? Well, yes.
Very quickly, I just wanted to chime in on one more piece of it. So on last Monday, I was at the White House with the President and Vice President in the Rose Garden as they announced the Broadband Affordable Connectivity Program's new iteration. And I just hope that all of the media report on this. I just did an interview this morning with Radio Dia in Espanol to make sure that all of our Spanish-speaking members of the community are briefed on this very important iteration. What it does is it's an agreement with over 20 of our largest internet service providers that actually has them giving service at 100 megabits per second upload and download. That is an incredibly fast speed and will really help a lot of folks in the community remain connected. Now that $30 is actually then offset by the federal government subsidy as long as they are eligible for free or reduced meals, SNAP, WIC, EBT, and the like. We need to make sure that all of our residents who are eligible are signing up for this very important program. Some of them have internet connectivity now and are paying exorbitant prices. We want to make sure that we lower the price so that they can use that for so many other things that we see are increasing in price right now, whether it's gas, infant formula, food, the whole 9 yards. So we want to make sure that we're giving people the opportunity to do so. The website is www.getinternet.gov. Again, www.getinternet.gov. 20 providers, including ours that we know very well, Verizon and Comcast here in the area, that are participating in this program that is incredibly important to our community when it comes to bridging the digital divide. So just wanted to put that out there as well. If folks can please just mention it on their broadcasts so that our constituents know about this vital program that's going to help connect so many of our residents to affordable, high speed, high quality internet. So thank you, Lorna.
Thank you, Council Member. I would like to ask members of the media, do you have any questions regarding this last update granted by the Council Member? No? Okay, thank you for joining us today, Council Member Craig Rice. Thank you, and we'll move forward now with the public health update. Mr. County Executive.
Thank you, Craig, again. So back to our COVID update this week. Our rates continue to increase, and they've now exceeded over 350 cases per 100,000 residents. Our positivity rate and hospitalization rates also continue to increase, and these numbers do not account for the unreported cases that are being identified through rapid testing. You know, people who have these rapid tests at home, if they get positive cases or negative cases, they're dealing with them for the most part inside their homes, and we're not getting notified of results. And so we're just not able to capture as much of the picture as we did before when we were the ones actually giving the tests. But it's good that people are getting tested however it happens. It's just impedes our ability to get a better view of the data. We're currently leading the state in case rates, but we have the lowest test positivity rate in the state, which means that we're testing at a much higher rate than our neighboring jurisdictions are. And hence we're discovering more cases. This is a time for increased vigilance. We released a statement earlier this week, reiterating the message that we've been consistently saying for months now. Voluntary mask wearing is encouraged when you're in public indoor spaces for prolonged periods of time. Health experts say that BA 2.1.2.1 appears to have a transmission rate that's higher than many of the previous strains we've seen. And as you can see from this chart, the variant is now 55% of the cases that are seen in our region. So another variant is, sweeping through the region even before the other one is left completely. Outbreaks in schools statewide are up 85% from last week. All total cases tied to schools across Maryland are up more than 60% over the last 7 days. And yesterday, only one MCPS school had more than 10% of its student population test positive for COVID, but many are close to that mark. We encourage everyone to pick up free home test kits available at all county libraries, as well as other locations. Despite rising case counts, Montgomery County is in a much better place than we were during some of the previous waves. Montgomery County is one of the highest vaccination rates in the nation, and viral treatments for COVID are now available, which should have a positive impact on hospitalization and fatality numbers as this latest wave of cases continues. Our messages to parents is to keep your kids and yourselves up to date on vaccinations. If the time has come to get a booster shot, please do it. The effectiveness of the shot fades over time. Up-to-date vaccines help prevent quarantines, and they can help us combat the amount of community spread that we've already seen. And it has put us in the moderate risk category. So we are still continuing to do everything we can to encourage people to get vaccinated, so we can have the most effective effort at minimizing the spread of this variant. Since January, people 50 years and older who were vaccinated but not boosted, I should say, were 2 to 3 times more likely to be hospitalized from COVID than those who were fully boosted. So there is a difference that the booster makes. We can see it in our hospitalization rates. So again, please, if you're not boosted yet, get boosted. Just yesterday, the FDA approved Pfizer's request for a COVID booster shot for kids between 5 and up, and we expect CDC and the Maryland Department of Health approval in the next few days. The county is going to be ready to take advantage of that challenge, just as we have with COVID testing and other rounds of immunization. We don't want to reach the high category again. We don't want to see any more of our friends and our neighbors worry about the loved ones because of this virus. And frankly, we don't want to have to limit occupancy of events or occupancy of buildings. We would like not to have to shut things down. So we know how effective that can be, but we also know that if we do masking right and we do it consistently, we can avoid going there. So I encourage people to do everything you can to keep us on the safest track possible. Finally, I want to acknowledge that this is both National Police Week and EMS Week. Very grateful and thankful to the efforts of all first responders who are out working 24 hours a day, every day, every week. And this year's is very special for MCPD, which is celebrating its 100th anniversary. Last weekend, they held a community day event at the fairgrounds that attracted thousands of people who were able to meet and engage with our officers. I'm glad that I was able to stop by and see for myself the positive engagement that they were having with people in this community. I'm going to turn this over now to Dr. Stoddard and Sean for their updates.
Who's going to go first, Sean or Dr. Stoddard?
John can go first, and I may just have a few comments depending on.
Okay, great.
Sorry, I needed to unmute myself before I shared my screen. I couldn't find the unmute. Okay. So we'll go through, we have a lot of information today. I'll try to go through fairly quickly. Mr. Elrich already shared the updated case rate and hospitalization rates from the CDC's with the metrics that the CDC looks at. So what we'd like to do is share today some of the guidance that comes from the CDC and comes from the local health department about what that means, because we're in medium. We've been in medium now for over a week, and we just want to reiterate that it's very important, as the county executive said, to stay up to date with your COVID-19 vaccines. These are really making a big difference in the seriousness of illness related if you happen to contract COVID. So very important to stay up to date. wear a well-fitting mask around others. The CDC recommends, again, at medium, that, of course, we all know if you have symptoms or a positive test or you are in quarantine for exposure, to wear that mask until the symptoms subside, until you've reached 10 days for isolation or quarantine. The CDC also recommends to wear it when on public transportation. It's not only courteous to do that, but it really can help to keep people safe. You don't know who might be at high risk, who's on that public transportation with you. So please wear a mask right now when we're in this high transmission or medium community level and on public transportation. And additionally, as Dr. Bridgers has said, and as we're strongly recommending from public health, wear masks when you're in those congregate indoor spaces with limited social distancing and ventilation. It, again, can really help to protect not only you, but the other folks in those spaces. So again, these are the recommendations from public health, consistent with the CDC guidance. Again, reminding people to get tested if you have symptoms or are alerted that you've been exposed. If a contact lets you know that they're positive, please get tested. You know, we want to identify the cases and stop the transmissions. If you're returning from travel or you've been to a large gathering, that's a good time to do testing as well. And if you have a positive test result, just be reminded that universal contact tracing is not happening. Not every single person with a positive result is going to get a call. Many people are doing rapid tests and those results are not always reported. So, you know, there's no way for us to contact you, even if you're at high risk. So it is incumbent on you to let your close contacts know if you have a positive result. And finally, if you're at high risk for severe illness from COVID-19, again, it's recommended you wear a mask when you're in those indoor public settings. And we're also recommending talk to your healthcare provider before you have a positive test. Talk to your healthcare provider to determine if you're a good candidate for one of the therapeutic treatments. That way you'll know if you have a positive test, you'll already know what you might be looking for and whether to contact your provider then, or possibly go to a test to treat location or another site. So just to follow up on those therapeutics, we were in conversation with our state partners yesterday. They've assured us that the supply of these therapeutics is plentiful. There is lots of Paxlovid that have come in to Maryland, and providers have a mechanism to look up where that supply of Paxlovid is. So when they write a prescription, these are prescription therapeutics. When they write a prescription, they can again know where to send their patients to get that prescription filled. The eligibility for this, just reminding folks, is you need to be symptomatic, have a positive test, and be within the 5 days of the onset of symptoms. Again, Paxlovid is just for those who are 12 and up, and you need to weigh at least 40 kilograms. And Paxlovid is being recommended for those at risk for progression to severe COVID-19. So it's those standard underlying conditions that put you at greater risk, including age, and potentially if you are not up to date on vaccinations and with those risk categories. The reason we're trying to spread the word on this is the data has shown that Paxlovid can help to have an 88% reduction in hospitalization and death. And that, again, may be a reason why we're seeing fewer people end up in hospitals now, in addition to the high vaccination rates. There are some other medications that have been approved and that providers may consider and may be a good fit. And again, there's Evusheld, which is the pre-exposure prophylaxis for those who are moderate or severely immunocompromised over 12, that they can get that monoclonal antibody, and that will help protect them in ways that vaccines are not fully protecting every moderate or severely immunocompromised individuals. They're still recommended to get the vaccines, but this is another option to increase protection. The county has this morning updated its web pages to have a therapeutics page now. We include information about where to go for test to treat if you're in those high risk categories. And you can potentially have a very quick or expedited way to get tested. If it comes back positive, those pharmacies and locations can fill that prescription right there and start you on a treatment. Additionally, if you don't have a healthcare provider that can screen you and write a prescription, there is an online or a phone service you can call, and they will free of charge review your information and determine if you're a candidate as well. So we'll continue to update the webpage with additional information about therapeutics and build this out again to try to connect our population with this really important piece of the COVID response. So going into, again, our data, I know our county executives already covered the lower transmission rates in our county, the lower test positivity rates. The transmission rates are very high. Currently, our hospitalization rates continue to be much lower. The census we did on Monday had 87 hospitalized patients with COVID diagnosis. We saw a modest increase in the acute care beds at our primary hospitals from 40 to 47 and 2 additional ICU patients. Again, these increases are much, much lower than what we've seen compared to the transmission rates that we're looking at. The biggest increase has been an additional 20 patients who were transferred to the alternate care site in Tacoma Park, the Adventist Hospital alternate care site. And again, these patients, some of which were transferred from county hospitals, some from other county hospital outside of our county hospitals. But that is the biggest increase in the hospitalized patients currently. We, again, just sharing with you the data on COVID-related deaths through the first week and a half of May. We have 7 reported deaths in the county related to COVID. This is a slight trend upwards from the previous month and is likely reflecting again that increase in cases that we've seen over April, and unfortunately resulting in a slightly more than a half dozen deaths to date. Again, this data can take a while to come in, and we are hoping that this will continue to stay low. Obviously, compared to the previous Omicron spike seen there in January, a much lower death rate than we saw with that previous spike. And we're again hoping that it remains low. Just to reiterate, of course, the lower hospitalization and death rates for those who are staying up to date on their vaccinations. We're really hoping that our residents continue to hear this and continue to come out to get those boosters. One thing that we'll talk about, I know we mentioned in previous weeks, how this wave has been going a bit longer than our initial models predicted. As you can see from the variant proportions that have been identified through the CDC for our region, you see the growing number of the BA.2.12 strain. As Dr. Stoddard mentioned last week in relation to these questions, that there are multiple variants going on now, and that could be complicating this. When we look at our data from some of the other states, you can see how many of those states, especially we're looking at some of the New England ones here, many of those states had a gradual increase, and then with a sharp trend up over recent weeks. Similar a little bit to what we're seeing here in Montgomery County. That could well be the BA.2 variant with the modest increases, and then the BA.2.12 causing a greater spike, a higher transmission rate over the last few weeks. This is from the New York Times webpage, and they one thing that they do is to give us context. They compare the current cases, hospitalizations, and deaths to the previous high point, not inclusive of this winter's Omicron, but the previous high point, which was last winter. And for context, you can see in New York State, for example, their cases are at 70% of that previous peak, but their hospitalizations are only at 34% of the previous peak, and their deaths are only at 11%. So you can see that this wave this provides us some good context of how this wave is playing out with high number of cases, but much lower percentage of hospitalizations and deaths. And we've included the Maryland data here as well. You know, it's currently lower than some of these New England territories, and it's again we're predicting we may continue to go up for another week or two with our case transmissions. Again, we're tracking. We do think that potentially New York and some of the New England areas may be a little bit ahead of us in the BA2 and BA2.12 transmissions. So hopefully this will give us some idea of when our transmissions may break. Looking at the global cases, we have the US country nationwide, we are up 31% in cases from the previous 7 days, whereas much of the rest of the world is seeing mostly declines overall in the overall COVID transmissions. One chart that we've been looking at and we wanted to share with you this week, this is within Montgomery County. Again, it's a ratio of the cases of the new cases to the hospital census. So just keep in mind, new cases, there's going to be one data point for each new case, whereas the hospital census could each week could include people from the previous week, the same person from the previous week. But it's still helpful to look at how that ratio played out. Of course, at the very beginning of this, where there was very limited amount of testing, it's not surprising that the ratio is much higher of hospitalizations to the amount of testing that was done and positives that were identified. But you can see both from the BA1 spike in December and January, and now even more so with the current wave, that hospitalization rate is much lower. The orange line being the hospitals corresponds to the numbers on the right side of this chart, whereas the case rates correspond to the left side of the chart. Again, it's just to give us an idea of how this wave is playing out differently with severe illness compared to cases. Overall vaccination rates have not changed. As our county executive mentioned, the FDA has approved the safety data for a booster shot for the 5 to 11. I believe the CDC is scheduled to meet, their ACIP committee is scheduled to meet tomorrow, and I think it would be likely that they will also approve this. Tomorrow is the ordering date statewide for vaccine, and we will, the county will be requesting additional amounts of pediatric vaccines, although it's been a slower rate recently. We will ask for more because we do anticipate there will be a bump in interest with approved boosters. We just ask our families to have a little bit of patience because we do need to wait for the state to deliver that vaccine. One thing to note, you know, our vaccination rates for the 5 to 11 is around 63%, 63, 64%. Fully vaccinated. This compares to the CDC data that nationally this rate is around 28.6. We're very encouraged that our parents are bringing children out to protect them, help prevent not only illness or shorten illness within that age group, but also potentially prevent other subsequent impacts, potentially long COVID and other things that we don't fully have data on yet, and how COVID affects these populations. We have seen nationally hospitalizations increase for children over the Omicron waves. Unfortunately, it is having a little bit more of an impact. Still not a high impact, but more of an impact than the previous waves. And again, just to underscore, why it's important. The FDA has identified, and the CDC has identified through data, that the vaccine effectiveness against COVID wanes after the second dose of the vaccine in all age populations, which is why all of the ages are now being recommended for booster shots. To share with you what we're seeing at our county testing sites, we have, for the second week in a row, we've seen about a 20% increase in volume for people coming out to get PCR testing, reminding folks that they can also pick up and do their own PCR testing, register it online, and then drop it back off at several of the recreation centers and at the Dennis Avenue Health Center. We are seeing at our sites a much higher test positivity level than the countywide public and private sites. Our test positivity level has been around 17%. Reminding folks that they can report their home tests. Those rapid tests, when reported, they're not included in the overall PCR numbers that the state publishes and the CDC uses, but this does allow us to potentially follow up with high-risk individuals and do contact tracing with them and provide them guidance and next steps. So we still want to recommend that people do report their rapid tests when they do them if they're positive, because it does give us additional information. And then just reminding folks, I know we are in a period of, again, high transmission in our county. And so rapid test kits are still free, still available at our libraries, as are medical grade masks. We're reminding folks you can come out and pick those up if they need them. Additionally, the federal program providing mailing rapid test kits to people's homes has been renewed. I believe you can request up to 8 rapid tests this go around to have mailed to your home. So just reminding folks of that availability. At this point, I'd like to turn it over to Dr. Stoddard for additional comments.
Just one additional. So as we announced earlier this month, Maggie Nightingale Library and Pools will be opening this week, actually on Saturday. And I wanted to confirm that they will additionally have rapid tests as the other libraries do. So that'll offer another opportunity for rapid tests for the up county. So I want to make sure that was out there publicly, confirm that with libraries yesterday. So when you visit Maggie Nightingale starting this weekend, they'll also, finish after the renovation, they'll have rapid test kits there. Other than that, I think that's all I wanted to include as well.
Okay. Thank you, gentlemen. Let's open it up for the Q&A portion of the presentation. And first up is Dan Shear from Bethesda Pete. Good afternoon, Dan.
Hi. This question, either Dr. Crowell and the county executive can answer as well, but I just wanted to ask about the number of homicides and overall incidents of violent crime that we've seen this year to date, and just wanted to hear the main concerns that you guys have and what factors you think are behind this steady rise, particularly when it comes to violence between teens, going off of the recent homicides involving teens in Germantown.
And so Dan, I'll start out that, and I'll let the county executive join in as he wishes. We are watching it with and working it through with the police department and with MCPS. We share the concern about those numbers. At least a piece of what appears to be going on is that we have a couple of things. One, obviously, is the increased availability of firearms, things like ghost guns that are showing up on the internet. And we had, during the time we were in lockdown and pandemic, people with a lot of time on their hands to surf the web, find guns, build them, and use them. And of course, the challenge is that once you've got a weapon, it increases the potential, and you're in a situation that increases the potential that you will use that weapon, whether it's for vendettas or for revenge or for other criminal activities. The other piece that we are seeing across the county and across the country to some extent is our young people have been in lockdown, like all of us, have been isolated, have been working through these virtual media, And in these kind of media, I can turn off my camera, I can turn off my microphone, I can say what I want to say, and there's no real consequence. But now we're back in person with each other, and the risk of saying something inappropriate or having an inappropriate interaction that turns sour and ends up with violence or potentially deadly, it seems to be escalating. I think our work with Montgomery County Police and with MCPS has been around trying to find ways that we can help our young people reacclimate to being back in person with each other, to spend time in ways that are socially appropriate, to resolve their conflicts in a more peaceful way. We've had our teams out in the streets and in the community, and the law enforcement has, I think, also been out and about trying to find ways to promote peace and decrease the risk of violence and especially in our young population.
Thank you. Is that it for you, Dan?
County Executive Elridge, did you want to add anything, or?
I mean, I basically agree with what he just said. I mean, I think, with the murders, these all seem to be people who know each other. This is, it's certainly part of a national trend. This is not something that's unique to the county. But this kind of sudden spike in, I guess, in behaviors that say, I'm going to settle my differences with you with a gun is really, I mean, I think it's alarming to everybody. I do think that COVID set a lot of people off. I don't think people, there's not like there are comprehensive mental health services out there where people who became, troubled, disoriented from society or disconnected can go and get assistance and find their way back in. And a lot of times, if people's lives aren't going well in general, COVID certainly didn't add to that. There are a lot of youth who, do feel disconnected, who don't know what they're going to do with themselves when they get out of school, who don't look at their lives and feel like, we've got great prospects, I'm ready to go back in and build my future. You've got a lot of kids who didn't think they had great futures to start with. And this has just added to it, I think. So I believe really strongly we've got to up the mental health ante. I think I mentioned this earlier. I've asked one of our hospitals to, look at a model for community clinics, because not everything happens in school and not every young person's in school. And these incidents occur between people, frankly, plenty of them are people who've been out of school. And so if we only focus on schools, we're going to miss, I think, some of the broader anxiety in the community. So I would like for us to start exploring what it would take to create a larger mental health presence in the county. I know there are adults who could use this kind of counseling. There are certainly young adults who could use it. And I think we're going to have to start thinking more broadly about how we attack this.
County Executive, I just wanted to add that to your point that the students and schools, when schools end, a lot of the services that are provided in schools can end as well. Part of what we're working on is our ways to make sure that our students, our young people, have activity and ways to engage beyond the end of the school year that are healthy and supportive of them to try to address these issues. And the mental health piece is one of those things that the country is finally beginning to come to grips with, the fact that the system for a long time has been under-supported and under-resourced. And so you have done some things to try to build that this year. The council has added some things to the budget for this coming fiscal year, and we will use that on behalf of the county residents to try to strengthen our behavioral health system in the county.
We also will be, we are having a series of meetings internally to discuss exactly how we can bolster some of our efforts in the space. I know Council Member Rice, Council President Albornoz, Public Safety Chair Katz have all expressed a lot of interest in trying to identify places where we're being successful and where we can expand programs to address that. I know the Street Outreach Network had a lot of focus in the budget session last week from Councilmember Navarro as well. So there is a lot of interest in trying to look at this issue as closely as we can, discuss the interventions that can work and have worked, and trying to expand those. But we are going to be having a series of meetings with internal staff, with with the elected officials, to try and really identify what can be successful and how we can improve what we're doing and offer more of what we're doing, because we know that as Dr. Kroll and the county executive alluded to, we know that there's a mental health crisis. We know there's a proliferation of firearms in our communities across the country, and all those things. It's a problematic combination of things that drive these things and are driving them across the country. And we obviously, have things that have worked, and we want to make sure that we emphasize those.
Thank you.
Thank you, Dan. Next, Kate Ryan, WTOP. Good afternoon, Kate.
Good afternoon. Thank you so much. I have a couple of things I want to ask about, and I will kind of try to keep it quick. Number one, on the masking in schools right now, Montgomery County has what I think is a formula of if there are 3 cases in a classroom, they will ask that people wear masks in that classroom, or are they requiring? I'd like that cleared up. And have they done this in conjunction with the county? I know they have their own medical officer. Are they getting advice from you, or are they simply telling you what they're doing? What about a requirement? At what point would you see either the schools or the county having to go, all right, we need masks on, given the transmissibility of this variant?
It's okay. Great question. I'll jump in, and I'm sure others will take an opportunity to share their comments, because we've all been in this fight together. So no, they aren't telling us what to do or what they are doing. We are providing the recommendation based on CDC and MDH regarding mask requirements based on community level spread, as well as community level transmissions, which are different, that Mr. O'Donnell talked about. The outbreak that they are referring to in the recommendation that they have implemented are for particular schools where there are 3 or more cases or unrelated, or those schools where there are 5% or more of the staff, students, or faculty, educators who are impacted, or there's an outbreak. So that's the formula that they've been using. And this formula was implemented and provided by MSDE and MDH back on March the 2nd. Nothing has changed. It was on the tail end of Omicron, and we are managing the response now based on those, the lessons that we've learned during the Omicron spike, now with the sublineages that are out there. So they are recommendations based on those community levels. Now, the second part of your question is there a threshold? And I know Steve has often asked this question before. Based on the community levels, we look at those case rates, 200 cases per 100,000, above and below, and up to the highest level, which is over 500 cases or more. So there's no one particular case metric that we are looking at. We are planning at all levels for community spread based on CDC's current definition: low, medium, and high. And at each of those levels, there are additive layer preventative measures that we've talked about, that the county executive has made in his remark weekly. So that's the way forward. That's the next normal. And so we are providing recommendations, but the guidance that's set forth by MCPS is based on their data review, what they're seeing in their individual schools, and what they are communicating to the principal, staff, and students.
Okay. And is there a point at which masks would be mandated either within schools or countywide?
We have no current recommendations either at the state or county level for indoor mask recommendations. And again, as a reminder, if there's an indoor mask mandate set forth by MCPS, it would be vetted through their Board of Education and/or additional guidance from MSDE. If there's an indoor mask mandate, the recommendations for it would come from me as the acting health officer and chief of public health, along with the recommendation to the council sitting as a Board of Health and/or the county executive for his consideration.
Got it. Another thing, Monday, we had the briefing with the county council president, and I didn't ask about the health officer. And then we found out that we don't have a health officer. The latest candidate backed out. And Dr. Kroll was kind enough to talk with me about that yesterday. But Mr. Elrich, what are your thoughts on this? We are now without a health officer. And Dr. Bridgers, no disrespect at all directed towards you, but a permanent health officer since last September. And knowing that this vetting process does take time, what What's happening? What do you see the problem here?
I think a lot of things are happening. I think the health officer job was a lot more attractive when it looked like COVID was going away. As COVID's intensified and people anticipate a return to the kind of, I'd say, public situation that was less than positive, during the height of COVID, I think this makes the job a lot less appealing. I think, we're finding we're in competition with a lot of people trying to hire health officers. That doesn't help either. And then we find more of them going into the private sector where frankly, they can make policies within a company or within an organization that don't put them at risk of public exposure or making public policies. So I think there's kind of like a hesitancy to step into something which is, can be highly controversial. And that's a problem. There is a shortage of health officers more generally beyond Montgomery County. And I just think we're seeing a part of it.
Got it. And then if Mr. Councilmember Rice is still with us, I did have a question. I know you are very much in touch with the community that you serve, and seeing as the violence that we've seen among these very young teens, we're talking 14 and 15 now. We're not talking 18-year-olds or 19-year-olds, which is horrifying enough. What are community members in your community telling you about what they're seeing, and what else needs to be done?
Well, thank you, Kate, for the question. And I think that, again, when we look at some of the solutions that are there, it involves more than just government. Society has got to play a role in taking back their neighborhoods and their communities as well. And that's why we had that rally in Germantown at Black Rock, to try and encourage folks to make sure that we get out of this notion of not saying anything, not being a part of participating with the police in helping to make our neighborhoods safer. We know that when we solve these cases and lock individuals up that are murdering other people in our community is better as a result. We know the work that we need to do on the front end. We know that we need to provide more opportunities. You heard the county executive talk about that in explicit detail. The Kerwin recommendations with the blueprint for education, CTE pathways, all the things that we've invested in, as well as mental health in schools. But as you heard from the county executive as well, not all of our kids are connected to our schools. Unfortunately, some of them are disconnected from our school systems. And so we're going to have to double down on some of the things that we've been doing, working with our street outreach network, working with positive youth development, working with our Department of Recreation to provide more opportunities. That's why this high-level meeting needs to happen, and it's going to happen next week, because we need to throw everything at the wall on this one. This is where what we don't want is this to become a situation that's out of control. It is quite concerning right now, but it is not out of control, and we have an opportunity to stave this off before it gets there. But what folks are saying in the community is they want to see us put forth action, and we are also saying to them that we need you to put forth action as well. This is an all hands on deck approach to really making sure that we're trying to address this, to make sure that all of our residents feel safer and have better and secure access to great opportunities for their future, for themselves, their children, and their families as a whole.
Thank you very much. Thanks, everyone.
Hey, can I just add something to that? I mean, Craig, you make a really good point. I mean, there are a lot of adults in this community who have more contact with children in school than the county government ever will. And the conditions that are in the community are not products of things the county government did, and frankly, they're not products of things that the school system did. And this is going to require everybody to think about what are your roles in the community and how is everybody else talking to the children that are in their lives and in their community. If we think this is all going to come down to the government having a silver bullet that I can put, the right number of police in the right place and this will disappear, that's not going to happen. This ungluing of things is a deeper problem, and people are going to have to figure out, what is the role of the community groups, faith groups, other groups, in terms of trying to create a sense of, belonging and sense of possibility in kids. And I was a school teacher, and I heard kids say things at the age of 10 that were actually, pretty frightening to me, because when they were talking about where they saw themselves going, they didn't see themselves going anywhere. I had some kids who honestly, well, I won't even go into what they said. It was just disturbing. And we've got to figure out how, as a community, re-engage holistically. When we talk about the shootings, we can deal with crimes of opportunity. We can put more police out there. We can, increase the presence and make people feel, that this is not the kind of place where you want to commit a crime like that. However, so many of these crimes are personal, and they're arranged meetings, and the police are never going to be there for an arranged meeting in an apartment building or in the woods or stuff like that. So this is what makes this, so daunting. We could deal with the normal crime aspects of knowing what you do to, make a place less hospitable to crime, but interpersonal interactions, that is not something that policing or anything else lends itself to. But this is a place where, if friends know that friends are thinking about doing things, that they're trusting that there are people in the community they could go to and say, look, so-and-so's thinking about doing this, the situation could blow up. That's the kind of information that would be really helpful to have.
Got it. Thank you all very much again.
Thank you, Kate. Next up, it's Corey Smith, NBC4. Good afternoon, Corey.
Hey, good afternoon, everybody. So I have two questions. Going back to the health officer search. So with this latest person dropping out, are you all having to go back to the drawing board to your original pool of candidates, or is it, with 3 people now dropping out of the process, we go to our 4th choice or 5th choice? And then the second question relates to rental assistance. If I'm not mistaken, the cap on the rent increase at 0.4% expired on Monday. And I know you guys also have a new round of rental assistance that has started. Do you think one will impact the other? Do what's the sense you maybe get from the landlord community as, rents rise, across the region? Do you expect more people now to be going for this pool of rental assistance there in the county?
So Corey, I'll take on. Mark, go ahead. You want to start out?
Well, I was just going to say, we've not had a shortage of people who will go into the pool for rental assistance. The truth of the matter is that the assistance, because it's been limited, the amount of dollars we've gotten for this has not addressed ever all the people who need assistance. And so we've got a targeted population. We anticipate, I guess, and Raymond can talk more about that, we will certainly exhaust the funds pretty much out of our targeted population. And if they don't, we will expand it to a wider group. I'm very concerned about rent increases. I'm going to send over a recommendation that we extend controls for a period of time, but at a higher rate, because obviously 0.4% isn't going to cut it. But in light of the kind of what we're hearing about requests for rent increases, there are a lot of people who are going to be losing their housing because of rent increases. Not paying the rent's going to be the least of their problems. They're not going to be able to pay and cover the rent increases that may well be coming our way. And that's another one of those things that helps unglue society when people can't find places to live. So I'm very worried about what's going to happen.
I would just add, yeah, I think that's right. And we've opened up our second round of our most recent round of rental assistance, and we will run that until until we don't have any more funding in that pot. I do think that the CE is right when he says that we have no shortage of people who are needing assistance. The rising rents are going to put pressures on people, and I think that to the extent that folks don't get back to work and don't have the economic wherewithal, that we're going to see a rising number of folks who are going to be struggling. We do have rental assistance programs and relief and assistance programs that will continue to run. We just can't tell at this point whether or not we're going to have capacity to meet the need. And of course, availability of affordable housing is at the heart of a lot of this, I think.
And just a reminder that the money we have that's targeted, this is still COVID relief. And so your job loss, you have to have job loss that's attributable to COVID, if you just simply can't afford the rent increase, but you're working and, you're already spending 50 to 60% of your income, the federal funding is not meant to address that. So that's another, hole in all of this. I hope that, the landlord community recognizes what kind of havoc they could wreak if they, maximize the rent increases as has been done in some other places. It will not be pretty.
And if I can just jump in real quick, that a couple of things I wanted to note. So
Donna, for the members of the media, can you identify yourself, please?
Sure,
Thank you.
sorry. Alana Brands, I'm the Deputy Chief with Services to End and Prevent Homelessness within HHS, and we are administering the COVID rent relief program. So just to touch on a couple of quick things, Corey, related to your question. So the increase in rent charges, landlords do need to provide a 90-day notice for that. So that notice could start to go out on May 16th, but residents won't actually see those increases then until their September rent bill. And our COVID rent relief program, our round 4, given everything that the county executive and Dr. Crowell mentioned in terms of the extensive demands on assistance that we're anticipating, our application portal is actually only scheduled to be open at this point through June 30th. So we will not actually see in this round of assistance those that may be impacted by future rent increases given the expiration of the required cap on rent increases. The other thing, just note quickly, given the demand, we are only able to provide assistance in this round with arrears. And so again, there's a lot of challenges occurring at the same time in terms of the tension on households that live paycheck to paycheck and are struggling each month on their budget. But we will have to handle both of those a little bit differently, and we are working closely with DHCA to monitor where we're seeing some of those rent increases, to take the experience we're with other areas and even some of our cities within the county that it already expired. And we do have our regular eviction prevention programming where we could assist households in that way too. So we'll keep an eye on it, and exactly as said, we'll see. Hopefully there will be opportunities for additional funds, and we'll be able to open more rounds after this and continue to align the changing housing market with the assistance we're able to provide.
Thank you, Lana. Is that good for you, Corey?
Yeah, and just real quick on the health officer, I guess where does the process stand now? Are you all going back to the drawing board, or do you have another pipeline of 4th, 5th, 6th choices that you're ready to move forward with, perhaps?
So I would not say that we're ready to move forward with anyone who's in the list right now. We will be going back to our starting with a list of candidates and taking a closer look at some that we hadn't put forward earlier to see whether or not they would meet the criteria for going forward. We're also going to continue the search. We are going to continue to go back out nationally and use our search firm to extend and deepen our search. And after some conversation with the county executive and the county administrator, we're looking at options to maybe some strategies for potentially broadening the pool.
And one quick follow-up. Do you all have any sort of ballpark dollar figure on how much you've spent on this search thus far?
I do not.
Okay, no worries. Thank you.
Thank you, Corey. Up next, Steve Bonnell, Bethesda Beat. Good afternoon, Steve.
Afternoon. Porter's asked some questions that had encouraged me to ask this question. This could be for Alana or county executive to start off. You mentioned that obviously the 0.4% cap on the voluntary rent guidelines ended on Monday or Sunday, I believe, or the weekend. County executive, you mentioned a higher number than 0.4%. Do you have a number, or is that still being finalized?
It's not finalized. We're talking about it, but it's not finalized. It's not going to be high, but it's not going to be 0.4.
Okay. I guess you don't like 1-2%. I don't want to guess or put a number.
Don't guess. Save yourself the trouble.
Okay. Dr. Kroll, my colleague Dan does a really good job, so I don't want to insult him. But one of the things that's interesting about this increase in crime among young people is that, obviously you're a trained psychiatrists and psychotherapists. So I'm wondering, I just want to pick your brain, how COVID might have impacted this among younger people, and just given your training, I'm sure you've kind of developed or kind of thought of some things that might be contributing to this, if that makes sense. So I don't know if you've seen anything, or I figured you have good insight on that. So
Steve, just for the record, I will not be insulted by the fact that you called me a psychiatrist instead of a psychologist.
Oh, yeah, see, I'm gonna mess it up. My apologies.
This time. But this is something I have been watching over the last working through over the last 2 years. I'm not aware of any particular research that's directly connected to COVID around this, other than to say that there are, in a small number of cases, long COVID can have some impacts on cognitive and emotional balance of people. So we don't know yet whether or not that is a factor in any of this violence. So it would be speculative on my part to assert that. I do want to say, go back to what I said earlier about the level of isolation and disconnection from people. Our young people have been disconnected in some ways. I think, well, let me back up and say they remained remarkably connected digitally, as they always have been. But there has always been, alongside all of that digital connection, interpersonal connection and closeness that we have young people who have now lost that, and lost a lot of that over the last couple of years, just because we've been isolated and from the normal ways and places in which they connect to each other. So we are seeing some increases, not just in violence, but in terms of depression and suicidality and anxiety, and interpersonal anxiety, and conflict, and emotional regulation. I said to someone recently that you could, if I get angry in this forum, and want to say some things to somebody, I can turn off my mic, I can turn off my camera, and no one would ever know what I'm saying on this side, and I can just give vent. But when I'm in person, it requires a level of self-control and a level of emotional regulation. We have eliminated some of that through Teams over the last 2 years, and through Zoom and various media. And now we're having to relearn those kinds of skills by being back in person with each other. And I think that's true for our young people as well.
Well, thanks for that. Shifting gears here, I think Sean addressed this, and perhaps anyone on the health team can address this too, about kind of the update on boosters for 5 to 11-year-olds. Can you all just reiterate? So there's a final approval coming tomorrow, and then, or hopefully coming tomorrow. And I just want to know the county's kind of stance on rolling those boosters out. Is that going to happen in the schools like it did initially, or I just wanted more information on that as we kind of get close here to that final approval.
Steve, I can answer that. Yeah, so we know the ACIP's meeting tomorrow. I don't have their full agenda, but I assume they're gonna review this. I know the FDA did not even go to a committee to review the booster. They've already looked. Both groups have already looked at the safety data for this vaccine for this age group. They're basically just looking at efficacy of giving a booster, and FDA felt it should happen. I don't see any reason why the CDC wouldn't agree, and the state has been very quick to update their vaccine guidance and orders. So I think that'll all happen pretty quickly. The part that's going to take us a little bit is we have been trying to avoid wasting vaccine through expiration or other things. So we have a very limited supply at the moment, a couple hundred doses that we've scheduled for our clinics. We've been doing pediatric vaccines at the county clinics almost exclusively on the weekends, because that matches up the best with parents and children's mutual availability to come out to get them their first 2 shots. We do have a couple sites. We continue to work with MCPS, and I know we'll be at some schools this weekend. We'll probably exhaust the available vaccine during that. I know we'll be at Gaithersburg, I believe, on Sunday, Gaithersburg High School, I think, or middle school. In any event, we will circle back with MCPS, and we'll likely continue that partnership, continue doing the booster shots through their school systems. it's been so helpful to enable us to get to neighborhoods that we're not routinely in and get to the populations who aren't able to get to our sites. So yes, we do plan to work with the schools on this.
To clarify, if everything is green lighted, like you said, is the dosages, it's kind of getting in the weeds, but this weekend you could start at schools and other sites offering boosters, or will that be next week and beyond?
Well, we can, it'll be the same vaccine. I assume, I shouldn't make that assumption. The reason we wait for the CDC is they'll tell us if it's the same dose. I'm thinking it will likely be the same dose. And so we just have to let our clinicians know that this is now approved and do it behind the scenes. Sometimes the state and their partners who work on the medical records, they update the system to record that a booster is now being done for that age group. But all that aside, we'll be ready to go immediately. The question is, when will we get an additional supply of vaccine so we can do a larger number? Reminding folks that we don't have to wait for a new formulary. So private providers who have the pediatric vaccine, they can start giving it as well. So it's a little bit different setting than when it was first authorized and we all had to wait for it to come in. We just need to wait for a resupply to handle the expected increased demand now that boosters are recommended.
So Steve, just to add to Sean's in-depth response, we also wait to receive the clinical guidance from the Maryland Department of Health, as we've done before, and we communicate that clinical guidance to our community partners who have been instrumental in all of our vaccine efforts, and to make sure that they have the technical assistance and guidance and are prepared. So all of that goes into our capability operationally to administer any vaccine. And just to add, because you didn't ask, we've been planning for the 6 months to 4-year-old vaccines as well with our community providers, our pediatrician, and working with MDH. So we're ready not only for the 5 to 11 boosters, but once the under 5-year-old vaccines are available, we will follow the same suit and be prepared to administer them as well.
Dr. Bridgers, you stole my next question about the lower age group. I mean, I can look at the headlines too, but are we close to that? I know that was kind of anticipated sooner, and then there was a delay. And
the last read I heard, Steve, was June. And I know Dr. Stoddard and I have been tracking it back and forth, kind of doing our own quasi estimates on when they will be available. So we're still tracking, I think, mid-June.
And one of the interesting data points Sean went over is, I think 63 to 64% of the 5 to 11-year-olds in the county are fully vaccinated. That's a high number, but and correct me, you can all correct me if I'm wrong, but that's probably lower than, you know, seniors and other age groups that you all kind of analyze here. What have you been hearing, or kind of how you kind of analyze that about why that number might be lower than other age groups that have come forward to get the vaccine?
You know, this is a national trend. It's even been a trend in our county, even with very high vaccination rates. Each subsequent group that is authorized, it's a lower turnout. Some of that is likely because of lower risk for serious illness, and so lower perceived risk may mean that, you know, there's less urgency to get the vaccine. But, you know, our highest vaccinated group are our seniors, and so on down the line. You know, there's also, it could be that many of these individuals have gotten COVID and they don't think they need to get a vaccine. What we've seen from national peer-reviewed evaluations, the vaccine provides a greater immunity than simply contracting COVID. And so that's why we strongly recommend the vaccine and the boosters too, because both immunities wane over time. So I think that's some of what it is. You know, I think it was, I forget which news agency reported at one point, they looked at all of the counties across the nation through CDC data, and they found that more than half of the counties in America had less than 10% vaccination of that age group, which is just astounding. It's very, very different from the parents. So it's parents deciding not to vaccinate their children or not seeing an urgency. Those numbers are very different when you look at the Northeast, where there's much higher vaccination rates. And so, again, that's what we're seeing here, but it is a little bit of a lower rate. It's steadily creeped up over time, but it is lower at this age group.
Sean, would just add to that there is a tendency, all of us in this room probably know someone who's had COVID, who's contracted COVID within the last several months or within the last 6 months or so. And each and every one of us has someone who's contracted it, and they've lived through it. It's been a bad cold. The combination of our vaccines and a less virulent form of the virus gives us some sense of, well, that just means it's okay. I mean, they'll get it, they'll be fine. It'll just be a bad cold. And what we don't see as individuals are the vast numbers that you and I are looking at, and we're talking about how many people are being affected by that across the country. So there's a level of false security, I think, that people are beginning to feel about COVID, and that makes them less anxious about getting vaccines and seeking out a booster.
Sean, I just want to add on, that was I'll try and find that article you mentioned, but about half of the counties for the 5 to 11s are as low as 10% versus, that makes our number look a lot better. I didn't know that, but how much of that is how educated our population is and kind of how, we have a lot of national healthcare apparatus here. Anyone can answer that, I guess, but that's kind of what jumped into my brain right away in terms of just that sheer difference.
Yeah, I mean, we know that Montgomery County is one of the healthiest counties in America. Before we even talked about COVID, we have a higher than average level of education in our county. We have lots of great access to amazing hospitals. We have a lot of infrastructure here, and we have a lot of people who believe in taking care of their health and living a healthy lifestyle. This is on average, and so that brings it all up. So that's those are certainly things that are helping us out. In the overall vaccination rates across the board. I do think that there's definitely a word of mouth phenomenon that we're seeing, where when communities talk to each other in social settings and they talk about, did you get vaccinated? Did you get your kids vaccinated? Once you start seeing people do that, there's less resistance, and it probably works the opposite way too. If you're in a community that there's not a strong belief in vaccinations, it probably works against it. I don't understand why there are communities with extremely high adult vaccinations and extremely low childhood vaccinations. But that is fortunately not happening in our county.
So Steve, I'm just going to add a different opinion to that. Thanks, Sean. But also we have, I know we've had many questions about having a permanent health officer, having a health officer, when are we going to get a health officer? But I want to just say that we have an exceptional cadre of health professionals on our teams: clinicians, epidemiologists, research scientists, internists, specialists, pediatric doctors who help us shape and form the message. Dr. Kroll and our county executive, and even Dr. Stoddard, who is part of our core team, look for various ways to reach our community. We look beyond what's readily available or in the immediate future, I should say. So we go outside of those means to look at different ways. So if the feds in the state are saying something, we look at county level metrics to increase our ability or response or capacity to expand. And so that's what we've been doing. That's been our success story, and we will continue to do that.
Thank you, everyone. And thanks, Sean, for sending this.
Thank you, everyone. Thank you, Steve. Next up, Kevin Lewis with questions for the county executive, ABC 7. Good afternoon, Kevin.
Hi, good afternoon to all of you. County Executive, I heard that there's talk underway with the FOP and the police department to budget in new uniforms for all sworn officers in the coming fiscal year. Is there truth to that? And do you mind telling me a bit more about where the idea came from and the cost and what types of uniforms are being looked at?
Please, Mr. County Executive, please unmute.
Sorry about that. Somebody asked me a question. You were asking me about uniforms?
Yeah, I understand that there's ongoing conversation between
it's true.
county government.
So, one of the things in kind of reimagining police was reimagining the look of police. And there's a pretty broad consensus that the black uniforms are intimidating and they're meant to be intimidating. And we don't want people to appear to be intimidating. And so we've been discussing with the department and with the union alternate colors for police uniforms. And they're still in the process of deciding on a color for the rank and file police, and as well as colors for the management. And when they settle on colors, then we'll be changing the uniforms over to different colors.
Is there a department that comes to mind that you're modeling after that has taken this reimagining approach where a uniform appears to be less intimidating to the public?
I can't think of a department per se, but I know departments have changed uniforms, and some departments have gone to lighter uniforms than they had in the past. I know this issue was raised actually with us originally by FOP, who thought that a change of uniform would be a good idea. I happen to agree with it. I know that people in the community had similar thoughts. So I think it's something that we ought to do, and that will help take some of the intimidation out of the appearance of an officer.
Roughly speaking, how much would this cost to provide new uniforms to all 1,300 sworn officers?
Depends how we roll it out and how we phase it in. We replace uniforms anyway, so it's not like we don't buy uniforms. These would be just different colored uniforms. But we're still working on it. So when they know what it's going to look like, I'm sure we'll get pricing and we'll move down that road.
Millions or more in the hundreds of thousands? I know there's different ways.
I've got over 1,000 officers. So I'm guessing having uniforms for everybody is going to put us over $1 million.
I have flashbacks just picturing, the uniforms during the sniper attacks from 2002. I believe those were more like lighter color, tan, desert colored uniforms. Do you know when the department went to the darker current look?
I honestly don't know when they did that, but I'm glad you can remember back to what they were wearing during the sniper, because I cannot. I do remember the lighter uniforms, but I don't associate it with that.
And any difference in the way the uniform feels on the officer in terms of if it's more, lighter breathing for the hot summer months, or, that was raised color, or is it there going to be some actual different looks and feels for officers and the public alike beyond color?
So I'll just say, I'm not the one judging this. This is something that we leave to the department and to the officers. So I haven't gotten involved in the beauty contest of all that stuff. But one of the points about being a lighter color is that a black uniform is hot. And in the summer, it's just more uncomfortable. So this should be a more comfortable uniform than the one they're wearing today.
I'll just add in, Kevin, there's a joint health and safety committee that with the police and the management and the FOP that reviews all the different materials they invested in. They're in the process of investigating several different options, but yes, it is meant to be more light and breathable, more, obviously the amount of equipment that they have to carry has changed over time. Has to make sure that the new alternatives also offer different options for, we've talked about pepper ball guns and other equipment like that to make sure that that'll all work in this new environment. Body cameras were not as prevalent when the original uniforms were developed or the conversions that had occurred. So there's lots of new elements of technology and equipment that officers have, and we want to make sure that the uniform supports that mission as well.
Is there a packet at the county council yet that you know of, Earl, or has the Public Safety Committee not held a formal meeting where this has been discussed to date?
It hasn't, to my knowledge, it hasn't been formally transmitted or discussed at this point yet. It's just internally being discussed, and they're putting together a proposal, what it might look like for, as the county executive said, what the total cost will be, but also how that could be phased in over a period of time. Recognizing you don't want officers to look like different from one another, but you obviously don't need to replace every uniform. You have specialized units, you have other units you can do in certain orders.
All right, gentlemen, I believe the county executive needs to go step out to his next meeting. We do have a couple more reporters that have questions, and I know Dr. Bridges has also a meeting at 2:00. I hate to interrupt, but we need to move forward. Heather Curtis, WMAL, you have some questions? Bye, Mr. County Executive. You have to go. We will continue with the rest of the participants.
Thank you. Bye, everybody. And see you again next week.
Good afternoon, Heather. You have questions?
Yes, hi. Yep,
Hi.
I have two separate questions. The first one, obviously this frustrating search for a health officer and not being able to, get a candidate to stick around, accept the job. Best case scenario, how long will it take to hire someone?
Hi, Heather. It's a good question, actually. I'm glad you're asking that. Our typical search parameter around someone of a position at this level, at least my experience has been in the time I've been in the department, is around 6 months to craft a position, recruit it, get through the interview process, and make someone an offer that they accept, and then do a nomination, and then give them a chance to say goodbye to their old job and join us. So 6, maybe a little longer. So we're now at going into 8th month, I think. We're completing about our 8th month on this. So this is a little longer than we normally would have expected. Going forward, I think COVID has slowed some things down. I think the intense competition in the market has stretched it out in some ways that we didn't necessarily expect. So I'm guessing it's going to be several more months before we actually have a candidate in the mix. We're farther down the pipe because we have all the parts in place necessary to do the search. We just don't have the candidate that we think is the right candidate for the job sitting at the door waiting on us right now.
Thank you. And my other question is, obviously there's been a lot of talk about boosters today, second boosters. People are 50 and older are being urged to get those second boosters. I live in Montgomery County. I'm under 50. I'm looking at my booster card now. I got my booster in December. So I'm wondering, for people under 50 who may want a second booster but aren't eligible yet, are you concerned that may lead to be fueling some of the spread because people like me, my immunity is waning?
Well, I would have to defer on this one to the reviews at FDA and CDC. They are getting data from the vaccine manufacturers, and they're looking at it at all age ranges. And the declining immunity has when they've looked at this previously, they've seen that it declines more quickly with the older populations, which is why they've been the higher priority for the boosters. We don't have access to that that research data and how it's impacting the younger populations. So we would have to defer to their judgment on this because we just don't have information about it. What we have seen in our county, though, is obviously those infections are higher, at this point during the phase, during this variant, but the serious illness is not really occurring. And so that may be supporting the the current strategies for boosters. But if they come back and say, no, we're going to recommend boosters now for this age group, we certainly would, again, defer to their judgment with the data that they're looking at.
Thank you so much.
And just to follow on with that, there are other groups that do have more concerns about the immunity, and they are recommended for boosters at younger ages, and including our immunocompromised populations.
Thank you.
Thank you, Heather. Thank you, Kevin. I forgot to thank you. We needed to get the county executive to his next meeting. We have one more follow-up question. Jack Moore from WTOP. Good afternoon, Jack.
Good afternoon. Thank you so much. I know it's been a long briefing today. Returning to the topic of COVID in schools, I understand that DHHS is providing recommendations to schools on when masks should be worn based on CDC guidance and MSDE guidance. But could you briefly, I haven't had enough coffee today, can you just briefly, in a nutshell, what are the recommendations for wearing a mask in school?
So, great question, Jack. Couple of comments. So when we look at masking in school, we look at those outbreaks that are 3 or more in a classroom, and we also look at the percentage of outbreaks for unrelated cases in a school setting, which includes students, teachers, and staff. And so we work with our communicable disease and epidemiology team to identify those outbreaks through the MDH Red Cap system, which is a system where they report the number of outbreaks as reported through PCR or viral tests. Now, we also work with MCPS to recommend those guidance. We want to mitigate and suppress any further exposure, So we look at masking options and recommendations. We know that indoor wearing masks where there are tight spaces less than 6 feet or 3 feet may suppress those outbreak cases. So those are the recommendations that we have provided to MCPS regarding their school community. They know their school community, and we work synergistically to provide the best practice for them. So that's where we are. That guidance was an interim guidance that was set forth back on March the 2nd in collaboration with the Maryland State Department of Education and the Maryland Department of Health.
And a quick follow-up, sorry, Dr. Bridgers, earlier you mentioned the 5% threshold. So where does that factor in?
So the 5% threshold is a percentage that's based on the data that we receive from the Maryland Department of Health. So when we receive those data, we do the contact tracing, we follow up with MCPS, we identify those school settings, we identify those teachers, those students, and the staff. We make those recommendations to isolate if it's a positive case, if quarantine is necessary for those who are unvaccinated, and or other options that we continue to explore. One option could be a test to stay, but we are following up with the Maryland Department of Education to see if all of those relevant layer preventative measures are in place. So that 5% number specifically is based on the guidance that we receive from MSDE and MDH.
Because I see on the MCPS COVID dashboard, there's probably about a dozen schools that are above the 5% threshold, and MCPS, I believe, told us yesterday only one school is doing masking school-wide. So I'm trying to figure out the disconnect there.
So we provide the data based on outbreak. We follow up with MCPS regarding the information that we receive from the Maryland Department of Health about those outbreaks. So from HHS's perspective, we work with MCPS. The numbers that they may report that may cause a disconnect, maybe those reported numbers, those rapid tests or those tests that are reported to the schools. And so when they identify an outbreak to manage and mitigate those outbreaks, they work with our CD&E team to identify the cases, to identify, which is called a line list, which is different from an outbreak list, which is what we receive from the Maryland Department of Health. So the numbers, the data reporting are different, which may seem like it's a disconnect, but our systems are talking. So where their dashboard may be reporting, we may have additional information that we share with MCPS to ensure that we mitigate and suppress any further outbreaks.
Is that good?
Thank you.
Thank you, Jack. Thank you, everybody. I do not see any more questions from members of the media coming going once, going twice. All right, I guess that's it for today. Thank you for joining us. Thank you, Council Member Craig Rice, for being our guest today. And we'll see you next week. Stay safe.